Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. May is National Stroke Awareness Month. Stroke is the second leading cause of death worldwide, and it is the fifth leading cause of death in the United States. However, it is the first cause of disability. Here's a health talk that talks about diagnosis and treatment of stroke.
I was running band class like usual, and then all of a sudden I looked down at my right arm and I couldn't recognize that it was my arm. I thought, whose arm is that? And then the students started asking me what was wrong, and then I couldn't answer them. So I was paralyzed on my whole right side and I couldn't talk.
Someone that experienced symptoms of a stroke, they should call 911 right away. EMS will arrive and assess the situation. If it looks like it's a stroke, they'll take the patient to a certified stroke center.
Stroke is a medical emergency caused by a blocked blood vessel in the brain. As far as treatments for stroke, there are two main ones. They do the same thing. So the medical treatment is called TPA. It's a medicine that we give that breaks up blood clots. That's given in an IV, and it breaks up clots in the brain. There's another treatment called embolectomy, where a surgeon actually goes in directly and pulls the clot out of the brain. The most important thing with stroke is that it progresses quickly, and the things that we use to treat it are very time limited. They have to be given very quickly to help somebody. So the most important thing to do is call 911 and get to the hospital as quick as you can. The warning signs of stroke are difficult. The American Stroke Association came up with a memory aid called BFAST. So B is for balance, sudden inability to walk or stand. E is for eyes, trouble with double vision or loss of vision. F is for face, facial droop. A is for arm weakness on either side of the body. S is for speech, trouble talking or understanding. And then T is for time, because all the treatments we have are time limited, so people have to act quickly. For stroke treatment, the most important thing is to come to a facility with multidisciplinary care.
Stroke historically has been something that's been very difficult to treat because we didn't have a lot of weapons to help treat that stroke. And that really all changed in 2015 with people that had a stroke because of a large blood vessel being blocked. We could do something very similar to a heart cath, going through the blood vessels of the leg or the arm to pull the blood clot out of the head and select patients to really extend that. And now we have time windows that show that that's a safe and a very efficacious therapy up to 24 hours in certain stroke patients. What determines whether we can treat patients 12, 15, up to 24 hours after stroke is largely based on what's called perfusion imaging, meaning that we're able to look at the blood flow through the brain with a CAT scanner and assess what is already brain that's permanently damaged versus what's brain that's starving for oxygen and starving for blood, that if we restore blood flow, the patient's symptoms may improve. We now get these scans on our phone, and we're able to see immediately and identify when a patient has a large vessel occlusion stroke and know whether or not they're a candidate for thrombectomy. This technology can basically be put in any hospital, and we can have access to that and know when these people that are having these devastating strokes arrive at some rural community hospital and know that that's a patient that needs to transfer immediately for a procedure that could potentially save their life.
A comprehensive stroke center is a hospital that provides the absolute, complete, fullest, evidence-based, most contemporary stroke treatment options. And you need to be able to have a robust multidisciplinary team to help take care of the variety of conditions that can come in and cause stroke, and then also to help ensure that we are providing them with rehabilitation that will give them the best chance of making a good recovery. It's fully end-to-end treatment of stroke care from the onset of the stroke symptoms to return to normal life. That's the goal, and that's why we do the things that we do here. Stroke networks are relationships that are built between hospitals to help ensure the efficient triage and transfer of patients who might benefit from being transferred to a comprehensive stroke center. So we have outreach programs, and we have technology that we've helped to deploy to various satellite hospitals throughout the state If a suspected stroke comes into one of their hospitals, we've helped them develop protocols that will allow them to quickly and efficiently identify those patients. And that's extremely important because, especially here in rural Kentucky, it's very, very important that those local hospitals know what to do and where to send those patients when they come in with a stroke. Because when it comes to stroke, time is brain, and that's really what this is all about.
That's great information. And again, if you're having symptoms, make sure you get evaluated because time is of the essence. We'll be right back.